Hey Robin, how you doing today?
I'm great, George. How are you doing?
Good, very excited. We have a wonderful guest on today.
We do. We
Yeah.
do.
Okay,
Olivia
wanna
Sterling.
wanna take some time to introduce Olivia Sterling. She's one of our LCSWs here at Soho MD. Welcome to the podcast, Olivia.
Thank you. Thank you, George. Thank you, Rob. And I'm really excited to be here. I've always wanted to participate.
Awesome, awesome. So yeah, we wanted to talk about a couple of topics today. Touch on some cultural competency and cultural sensitivity. But before we get to that, can you just tell us a little bit about your journey as a licensed clinical social worker?
Yeah. I feel like I've been a social worker since the time I was born. My family enjoys it very much. But, a lot of my training started in college, um, and it's continued since. I have a lot of experience with individual and couples therapy, helping mostly people of color, especially women of color, that are living with anxiety and depression, and really helping them navigate a lot of the racial trauma that they may be experiencing or just overall life issues. Um, I've worked in different settings, again, really specifying that I wanted to work with people of color and that I am a champion for us in whichever setting that I was working in.
In your bio, we made a quote. I'm just going to read it so I don't misquote you. That you refer to yourself as an Afro-Latina therapist who specializes in providing culturally sensitive, holistic therapy across diverse populations. When you define yourself as culturally sensitive, can you just let us know, like, what does that mean to you?
Yeah, I think it means being aware that you are speaking with an individual that has a number of different cultural backgrounds, and being curious. I am a huge advocacy of curiosity, right? Even though I myself am Afro Latina, I don't for 1 minute think that my experience is the same as a sister that is Afro Latina. Not for 1 minute, right? Because we have different intersections in our identities that really help us to define who we are as a person. And so when I think of cultural sensitivity, it is being aware of that and being sensitive to that you don't understand someone's background, even if you can relate in some ways, you don't get it, right? And so to be culturally competent is to exercise that curiosity, especially in the therapeutic setting. Um, ask those tough questions of I don't know, can you tell me, right? And I have familiarity with this, but can you tell me a little bit more about what your experience has been like? So when I think of sensitivity, I think it's being genuinely authentic, being caring, attuned to what this person is experiencing. But then when I think of competency, is our own our own take, our own presentation when we are having this conversation. Understanding that I know my experience, it doesn't mean that I know yours. I know what I know, but I'm also curious about how your experience may be different than mine, without assumption, without bias. I may have an understanding, but I really want to get to understand how the intersections of your identity really inform who you are.
Do you think that I read in your bio that you've lived in all five boroughs in New York, which is like
Yeah,
amazing.
yeah,
Do you think that played a role into like you acknowledging this so much or having this
for
at the
sure.
forefront of your practice?
For sure. I mean, we know New York is the melting pot, right? But again, talking about that relatability and talking about providing that culturally competent cultural sensitivity and that thinking about how that comes into play, knowing that I have these world experiences, I think, because the five boroughs are very, very different. But knowing that I have these experiences of living in different five boroughs and also traveling and being exposed to a number of different cultures, I have a little bit of familiarity with something. So I'm not too afraid, or I'm not too uh, all knowing of any one person's experience. It's like, oh, I understand that. I think I know. So tell me a little bit more. What else do I need to know? If I wanted to experience it as you do, what would be important for me to know? That definitely informs how I show up to the practice. I think that's something that um, I know to be true for a lot of, I guess, my peers and colleagues, that we come to the work understanding our own identities, but there needs to also be some sort of um, confidence with understanding who you are, and asking the client or asking the people that you're serving to really share themselves with you.
I'm sitting here and I'm listening, and something popped into my head, and I think you just are kind of leading to it. When I took my licensure exam
Mm.
a long time ago, but one of the questions I remembered was, uh, I can't remember the whole thing, obviously word for word, but one of the things was about, like, what would you do when a child is being physically punished for something,
Okay.
and it gets brought to whatever authority, and then you're the social worker and comes to you, and the parents of that child, not white, say, this is what we do, this is my culture, I don't see this, I don't see this as doing anything wrong, this is how I was raised, so on and so forth. So is part of being culturally sensitive being mindful of what people have come to know and come to believe is, I hate to use the word right because it's not a right or wrong situation, but like, to be expected.
Hmm.
And so how do you manage maybe your own personal feelings about it, and really how do you talk to, like, let's say that child's an adult now and comes to see you, and you're thinking trauma maybe, right?
Yep.
And they're not, they have, like, this is it, this is my culture, this is what everybody in my culture does, what they're used to doing. So how do you address this very layered type of situation?
Yeah. I definitely I try my very best to understand what it means to them, right? Sometimes it can be that it is a traumatic situation that has stuck with them and that really has informed their identity. I'm always working through that strength based perspective. Um, if it is something that you feel has um, informed who you are today, let's try and figure out how and why. I'm really getting more to them as the person, and again through that strengths based perspective, and less about the cultural component. Of course, thinking sensitively about that and always adhering to the ethics of my practice and of social work, but um, really sticking to this person. Why? Tell me. I would be more curious as to why this is sticking with you. What does this mean about your identity and how you understand how you want to be in the world? And less about the cultural component of it. For myself, I know that I'm always double checking my judgment, my clinical judgment, right? If I know this to be true personally, what do I know clinically? Are there people within the field that I know that I can trust, that I can relate this to, and you know, um, get an understanding from peers? Because again, my experience is just my experience. It doesn't mean that that is everyone else's. And so I'm always asking my peers, mentors, what do you think about this? How can I be thinking about this? And help me debrief on this. I really do. One of the things that is important to me as a Black person is always understanding that It takes a village to raise a child, and we as adults have all been children, and I think we're just big children. And so it takes a village. I really come from that idea that we need to be more community oriented, and it's not just about any one individual, right? And so, how do we protect that person? How do I protect myself, understanding that I'm coming from community? Um, and how does that kind of inform the practice?
You said that it takes a village, to build to bring up a child, and I think that's a great quote. And just generally, do you think that minorities have had like a sort of stigma behind therapy? Just generally, and do you feel like that is getting destigmatized over the last, couple years or so?
Yeah, yeah. I think I shout out to the Gen Zers who are really big mental health advocates and very, very open and courageous in really beautiful ways. I think they really have brought a lot of awareness to mental health practices and the importance of it. I do think that you're right. There is a stigma and the stereotype of this being a very white practice, and you need to have money to go to therapy. And why would you give your money to a white person? I can tell your problems. I can, right? All these different stereotypes and assumptions that happen in different communities, especially communities of color. Um, but I do think we've made great efforts to destigmatize it as we are seeing a lot more people of color be honest and open about some of their mental health struggles, as Gen Zers become huge advocates and bring awareness to it, about to mental health and the importance of mental health awareness. Um, and I think as more people of color are being educated and trained to come into this profession and really um, destigmatize it internally and institutionally.
Olivia, you mentioned before the working with clients, excuse me, that are with anxiety, and some of that anxiety, depending on the patient, is triggered or born out of um, racial tension, racial trauma, systemic racism. So, is the treatment? Do you think the treatment for this type of this trauma trigger, if we just look at them
Mhm,
as like triggers for trauma, right, or
mhm,
those trauma based experiences, um, is the treatment different, do you think, than, I mean, that I work with a lot of trauma,
mhm,
so I know the modalities and the types of therapeutic practices I employ with trauma. Is there a difference? Should I be, right? Should I be looking as a practitioner, as a white practitioner? Should I be thinking differently, um, so that I can treat that trauma maybe more effectively?
mhm. I think that's a really great question, Robin. I definitely think that it is important that we as clinicians, especially as white clinicians, are aware of the dynamic, right? Because when we talk about trauma informed care, again, as you know, we're creating an environment where this individual should feel safe, for lack of a better word, right? Where everyone that is involved in this environment has the understanding of the impacts of trauma and how it plays out in behaviors, right? And so if we take that from not just like a institution or a setting, but bring it into the room, the therapeutic rapport, that has to be brought to the forefront, right? This is an environment where I'm expecting that we are going to be doing therapeutic healing work. And if we're talking about racial issues, how does my identity, either as a woman of color or as a white woman, shape what's happening here? Because I think that is it's a parallel process, right? Now you're not just talking about something that happened there, but there's something that's being played out right here with me and you. So bringing that up, being curious about how that impacts that, and I think being able to say it too, bringing that up so that the client feels like, okay, I can trust this person, that that level of power and privilege can be dismantled even in the the connection and therapeutic connection. Um, so yeah, I definitely think it's something to be aware of. I definitely think it's something to be mindful about, something to bring to the client's attention. And I can also understand how, maybe I don't understand, but I can imagine how, as a white clinician, that could be pretty scary to bring up. If someone's saying, I've experienced discrimination, I've experienced racial trauma in any different setting, and we can experience it in formally and formally, in all sorts of institutions and settings. So I think it's a little bit scary to bring that up and say, and how does that impact our work together? And what can I be doing to better understand how you're feeling? Um, it's pretty courageous. I definitely think that if we're not doing that as white or people of color, because I bring it up with white clients all the time. How do you relate to me as a woman of color? Right? If we're not talking about all of the different intersectionalities of our identities in the room, regardless of what they are, um, then I'm really asking, what are we doing? What are we doing?
From like patient's perspective, Olivia, how do you think that a patient could kind of feel out if their potential provider, is their first session there with the provider or a therapist? How do you think it's a good way for them to feel out whether it's a right fit, culturally, just in general? What are some things that you feel like patients should look out for?
Overall or with me?
Let's do you because and then overall.
Okay, okay. Because I think overall it would be two different things. Because I don't know, but I think that's a really, really good question. I do ask my clients to give me at least two sessions. The first session, I think there's a lot of information that we have to cover, and there's not a lot of that rapport building. So I do want to at least give it two sessions just to see if it's a good fit. So time, certainly, again, we're trying to build trust, and two sessions is not a lot of time at all. But I do think as much time as we could possibly get is important. Um, to find out whether this is a good fit or not. I think I think there's a little bit of a gut response or a gut instinctual response that tells you, okay, maybe I could trust this person. Maybe I can relate to this person. Maybe this person knows what they're talking about, and I think I want to continue my work with them. Um, so I definitely think you might be wanting to look for that instinctual response. You want to give it fair time. You also want to understand. I always, again, not only am I a clinician, I've been a patient for a very long time with different providers, different clinicians, and all types of different backgrounds. I think it's very important for you to ask yourself, what can I be learning from this person? What do I have to gain from this therapeutic relationship? Because it is a relationship, right? And so the same way you may ask yourself that about a friend, what type of friendship is this? What value does this friendship serve? You might want to ask that about your clinician. What can I learn? What do I want to take from this experience? Because it's going to be very different.
I have found, probably more so in the last couple of years, which I guess is very understandable. Um, I've had people come to me, for an intake, and I don't know if they maybe had not seen a picture before, so they didn't know if I was white, not white, whatever, right? I just assumed a lot of times people don't specify when they're coming to us,
Hmm.
or they specify woman.
Hmm.
I've been singled out as the older woman, so I have older people asking for me.
Okay.
But I know.
I believe it.
Yeah, yeah. Um,
What
it's pretty
happens when they get on
interesting.
the screen and they see that you're very young? Just
I
curious.
just, well, thank you for saying that I'm very young because now I love and adore you. Um, so, okay, show over now. Um, uh, but I've had this and go through the entire intake
Yeah.
and leaving space, right? But I feel like I do that naturally. I feel like, like, how are we doing? Like, as we're going along, the intake, like you said, is getting a lot of information. There's a lot of questions. I always tell my patient at the start, like, this is the least therapeutic thing we're ever going to do together. So just bear with the process. Um, and I've had, I'm like, do you want to, at the end, like, sure, do you want to set up sessions? Yes. And I've had three times now in the last, I guess, year and a half, maybe, where I was working with a person of color, and they didn't say to me, I would prefer to work with a person of color. Instead, they scheduled and then asked to schedule with someone else to discontinue with me because that's what they were looking for. What do you think we can do as clinicians? Is it okay to just say, are you comfortable with me being a white woman? Are you, would you prefer, like, tell me, like,
Mhm.
what's the dialogue here?
Yeah, I definitely think that's important to say. I bring it up, again, I bring it up with clients that I honestly, there are times where I don't know that I can relate or that we have anything that is the same, right? And so I bring that up. How does this inform our work together? Sometimes you'd be very surprised. Clients think this is who I've gotten, and so this is who I need to stick with. They don't really always know or sometimes even feel autonomous and have that agency to say, I don't know that I want to work with this clinician, right? And so I'm orienting the client to that. I definitely want to make sure that that is important, that the client knows you can choose your clinician. You don't have to work with me, even though this was assigned. But I do think as providers, we are, and I think it's tricky because I know we're also trained not to disclose, to self disclose, and not to talk about ourselves or our identity. But this is a therapeutic relationship. We're asking this person to be vulnerable and to trust us. So I do think there's a little bit of disclosure that needs to happen. And bringing that to the forefront, it can be something that as easy as, no, I know this. I don't mind it. Think you're great. Let's continue to the work. And great, we can continue to do that. Understanding that that is still informing the work too. Um, or sometimes people will say, "Oh my God, thank you so much for bringing that up," because it's something that I've been thinking about a lot, right? And so I definitely think it's worth bringing up. I do think that that needs to be part of the conversation and the dialogue. As myself, as a provider, this is what I'm bringing to the table. What does that mean for you? And is that something that you think you can continue to work with? Empowering the client from that standpoint.
I feel like this was definitely not enough time, and you were fantastic. And thank you so much for sharing. And you have such a wonderful way of expressing yourself. I really appreciate it. I hope that we could have a part two, maybe, and you would
Yeah,
be willing to come back.
anytime. Thank you both. Thank you both for having me. I definitely want to talk more with you both and hear about your experiences. That's important to me as well. So definitely invite me back for part two. Excited.
Awesome, Olivia. Yeah, you've been a great guest, and I deal with some of your patients on the administrative end. So whatever you're doing, I've gotten great feedback. Whatever you're doing, keep doing it. We're lucky to have you at the practice and on the show. So we'll be looking forward to having you on more episodes in the future.
Thank you so much. I'm so fortunate to be on the team.